Hi, today we're going to be learning the skill of emptying a urinary drainage bag. As always, it starts with a knock on the door.
Come in.
Hi, I'll be right with you. I'm just going to go wash my hands.
Okay.
As with any skill or patient care, we're always going to wash our hands immediately when we come in the room before we go near our patient. To see the proper way to wash your hands, please see the hand washing video. For now, we're going to assume that my hands are clean and I'm going to start my work. Hello there.
Good morning.
My name is Miss Andrews. I'm going to be your PCT for today. Is it okay if I check your name band?
Okay.
Okay, Mrs. Smith. I'm here to empty your urinary drainage bag. Is that okay if I do that now?
Okay.
Okay, I'm going to give you your call light, and I am going to provide you with your privacy. I need to just go get a couple of supplies, and I'll be back in a moment.
Okay.
Okay. For this skill, we're going to need a graduate so that we can measure the urine, and that can be found in the bottom drawer of the bedside table in the patient's room. In addition, I'm going to be needing some gloves and a barrier. Hello, I'm back.
Okay.
I'm just going to raise your bed a little bit.
Okay.
I am going to make sure that I pull this urine bag up off the floor, and it should never be really touching the floor, but I want to help to ensure that I'm going to get all the urine into the graduate container. Also note, be careful when you're using gloves not to touch any of the patient's controls, bedside railing, or their call light with your gloved hands. Now I'm going to put on my gloves. Most of these bags are the same way. The clamp is slightly different, but they usually do about the same thing. So you're going to hold on to this graduate to make sure it doesn't spill. You're going to open up the clamp with your thumb and make sure that the tubing is not touching any of the sides of the container. And since there's a lot of urine in here, I'm just going to stop right here. Ordinarily, we would empty the entire contents of the urinary drainage bag. I'm going to make sure that it's not dripping anymore, and I'm going to replace the point into its receptacle that is on any bag. I'm just going to move this a little bit out of the way. I'm going to take one barrier. I'm going to use that for the controller to put the bed back down. I am not going to put this bag all the way down to the floor, so I'm going to stop right about there. Okay, Mrs. Smith, you have your call light. I'm just going to go take care of this, and I'll be back.
Okay.
I'm now going to use my barrier to line the top of the countertop. I'm going to now take a measurement. I'm going to go at eye level and see what the measurement is, and it is at 400 mLs or 400 cc's. It's very clear that I can see it's at 400. I'm going to open up my commode. I'm going to discard this urine. There's a piece of paper in here. I'm going to discard this urine in the commode. I'm going to come and rinse. 1, 2, 3. I'm going to wipe this so it's not dripping. Close my commode. spray. And I'm going to replace this back to the patient's bedside. Using barriers to open up the patient's drawers. I am now going to remove my gloves, wash my hands, I'm going to record. Today is the 31st of January, 2014. Mrs. Smith. Room 101A. It is 12:35 p.m. and I emptied 400 cc's or mLs of urine. My name, and now I'm done with recording. Now I'm going to return to the patient. Okay, Mrs. Smith, we're all finished. You're going to open up your privacy. You do have your call light. Let me just fix you up a little bit here. Would you like your lights on or off?
I like it on, please.
Would you like your TV on or off?
On, please.
Would you like your window open or closed?
Can open it on, please.
Sure, I'll do that. Okay, if you need anything, again, my name is Miss Andrews. You have your call light,
Okay.
and I'll be back if you need me.
Okay.
Again, before I leave the room, I'm going to go and wash my hands one more time, and then the skill is finished.